Okay, it is 1:15 Eastern. We're going to jump in since we've got a lot of ground to cover. Welcome, everybody. It is lovely to be together, even virtually, and we have a wonderful panel this afternoon to get us going. My name is Barbara Weinstein. I use she, her pronouns. I am the director of the Reformed Jewish Movement's Commission on Social Action, and I am the associate director at the Religious Action Center, and I will be our moderator for this fantastic panel. And if you're here, I hope it's because you are interested in thinking what more we can do together to address the particularly unique challenges women have faced during the pandemic. And we know that for as difficult as the pandemic has been for everybody, there have been really unique ways in which women have been challenged at work, at home, and really on all fronts. And as I was thinking through how we were going to talk about these issues in this panel, I saw that really across the board, for example, the Time's Up Foundation shared that about 80% of healthcare workers are women who provide social assistance, childcare, emergency services. About 80% are women. We know that about 4 million childcare slots disappeared during the pandemic, even as it's, again, disproportionately mothers who carry the childcare burden. And a Center for American Progress report found that the risk of mothers leaving the labor force and reducing their working hours during the pandemic because of caretaking responsibilities leads to about $64 billion a year in lost wages and economic activity. So pretty staggering all around. And there have been impacts around hunger, around domestic violence, and a lot more, all of which we'll have a chance to touch on during our session this afternoon. And we also know that for every challenge that women face overall, women of color are impacted even more significantly. So there's a tremendous amount that we know we can do as members of the Jewish community, as coalition partners, as activists around public policy at the national level, at the state level. And to help us think through all of this, we have our wonderful panelists who are going to give us their wisdom and guidance as we move forward together. We'll have lots of time for Q&A, so put any questions you have in the chat. And for now, I'm very pleased to start us off by introducing our panelists. Darcy Hirsh is Director of Government Affairs for the Jewish Federations of North America and also serves as the Washington representative to the Network of Jewish Human Service Agencies. Darcy is a longtime Jewish communal professional and has been on the staff of ADL and as Director of the Virginia and DC Government and Community Relations at the JCRC of Greater Washington. Jody Rabhan is the Chief Policy Officer for the National Council of Jewish Women. Jody helps create policy and advocacy strategy. She represents NCJW on civil rights issues, economic justice issues, intimate partner violence, gun violence, human trafficking, and much more. Dorian Karp is Director of Public Policy and Advocacy at Jewish Women International, where she promotes policies that support and empower women and girls through coalition building, congressional advocacy, and more. She's worked in state government, the nonprofit sector, and in political campaigns. And Mia Hubbard is Vice President of Programs at MAZON, working on advocacy, grant making, and strategic programs. Mia's goal is to reduce and eliminate hunger and expand low-income communities' access to healthy food in the United States and in Israel. So with that, Darcy, I'm going to turn to you first. We know that social service agencies across the country have been really challenged by the pandemic. Lay out for us what the major needs we've seen are, and maybe if you can share a couple of examples of really effective responses from the Jewish community on the policy side, but also on the direct service side.
Sure, can everybody hear me okay? Good, all right. Thanks, Barbara. First, I'd like to thank JCPA for hosting this important session. And let me just say what a pleasure it is to be on screen today with such amazing advocates in this field. So the Federation supported agencies, the membership of the network of Jewish human service agencies, we serve nearly 1 million clients each year, and they support those who are most in need. Job seekers, older adults, people with disabilities, refugees and immigrants, survivors of domestic violence, just to name a few categories. And their client base is representative of the community at large. And the economic crisis increased demand for services significantly across all demographics, and bringing in many new clients that our agencies had never seen before. And so hot off the presses, last week, we just did a survey of the field. So this info is very current, but 94% of our agencies saw an increase in requests for mental health services. That's really the top need, but 91% saw an increase in requests related to food insecurity. 84% saw requests for emergency financial assistance. And of course, there was very high demand for support related to housing and unemployment. So really across the board, the economic crisis has affected the community at large, and those are the clients that our agencies are seeing. As far as specific populations, I want to flag that there was an 84% increase in requests for services by families with children. That's 84% of clients who had never walked in the doors of our Jewish family service agencies before. So how did we respond? I'd say that last spring we had a perfect storm, or whatever the opposite of a perfect storm is, with skyrocketing needs from the community, and at the same time the agencies were not able to provide services in the traditional ways that they're used to due to this deadly virus. So agencies needed to restructure their service delivery at the exact same time that there was an increased demand. Communal meals had to transition to home delivery, walk-in food pantries to drive-through, and in-person counseling and casework to telehealth. And so our policy response reflected this transition. We advocated for flexibilities in federal funding programs to make sure that our agencies can continue to meet these increased needs by letting dollars for communal meals be used for Meals on Wheels, and healthcare dollars to be used for telemental healthcare, and for SNAP beneficiaries who are at risk of contracting COVID if they went out to the store to be able to use their funds to order food online. And of course, we also advocated for many of the programs to directly support clients that I know my colleagues on the screen will discuss.
It's really helpful. And I know, for example, so many of the needs that you shared, Darcy, had to be met by social service agencies, but also because the social safety net from the policy side has so many holes in it. So Jody, can you talk a little bit about what are some of those holes? Particularly I'm thinking around paid sick leave and family leave, and kind of how does the US compare to other countries, and kind of what can we be doing to fill some of those gaps?
Thanks, Barb. Hopefully everybody can hear me. As you mentioned, there are definitely some gaps, and what we have known all along, we are sort of seeing front and center during the pandemic, and that is the holes that sort of previously existed are just, it's exacerbated. You mentioned some of the issues around women and job losses, Barb, in your opening, and certainly around paid leave, a national paid leave program that does not exist in this country. That is absolutely an area where America has really fallen behind. There are things like, getting back to the issues like minimum wage, things like the emergency paid and sick leave, as I mentioned, are they're not there for folks when we need them. We had emergency paid leave in the March CARES Act that was passed by Congress, and without that, it wasn't included in other pieces of COVID relief. We've really seen the difference. In fact, speaking of women and the impact that COVID has had on women, in December, for example, we saw 100% of the jobs lost were jobs that were held by women. Without the supports for families, without childcare, without home health care workers, it makes it very difficult for women in particular, women of color specifically, to be able to even come out of this pandemic in a way that allows them to sort of pick up where they left off, if you will.
Button. Thanks, Jody. You know, I was doing some research for some work we're doing at the RAC, and I was staggered. If you look at the list of countries that offer paid leave to their workers, it's like Bulgaria. I mean, countries you know think of the UK, Canada, but really countries that you would think have far less robust kind of social safety nets than we do, but in fact, quite the opposite. Pretty staggering all around. Mia, can you share a little bit about what some of the impacts you and MAZON have been seeing, particularly on single moms during the pandemic?
Absolutely. I mean, I think women have long faced, you know, heightened barriers to security and economic stability due to all of the long-standing issues that we've, you know, that folks have just raised already. Employment discrimination, the demands of caregiving, and wealth and wage gap. And we know that women, and in particular women of color, have been disproportionately impacted by the pandemic because they are disproportionately represented in, you know, what are now called essential workers. And many of those workers have had to turn to federal food assistance programs like SNAP well before the pandemic. Had a particular interest in single mothers, and we know that single mothers are a significant and vulnerable population. There are over 11 million households in the U.S. that are headed by single parents, and 8 of those households are headed by women. And even before COVID, female-headed households to experience food insecurity than any other family structure. And in fact, before COVID, it was estimated that about 40% of single moms were struggling to feed their families. So we know that when you have a family that doesn't have enough to eat, mothers are most likely the ones to suffer because they're going to skip meals, they're going to eat less to shield their kids from hunger. And so when we see families, you know, struggling to put food on the table, that suggests that there's a problem being faced by moms. So at MAZON, we've really been trying to focus on how can we help families, and we believe that part of that is obviously addressing those structural issues that folks have already raised that make low-income moms and women have to turn to the safety net in the first place. So really we have to acknowledge the realities of working families and those needs that they have, whether it's childcare, paid leave, affordable health care. So from our vantage point, we are focused on how can we boost the nutrition assistance programs like SNAP that those families rely on, and also how can we encourage Congress to support more creative options for supporting single moms. So one of the things we're looking at is how can we strengthen the connection between nutrition assistance and childcare, realizing that those are really important supports to enable single moms to stay in the job force. So, you know, our hope is that if we can enhance those kinds of supports, then we can move toward a more equitable post-pandemic economy that really centers about vulnerable families like those moms.
Thanks, Mia. I'm thinking too about the impact of having kids at home and not having the regular access they had to school breakfast and school lunch programs. That also must have had a significant impact, right?
Absolutely, absolutely. And you know, I think the federal government was initially slow to respond in many ways to the pandemic, but you know, they were able, the federal food programs were able to flex, and there were some new programs stood up. The pandemic EBT being one of them, which was, you know, they put on a food card to replace those school meals that were lost. And, you know, that was an important program, new program that helped these families get through this period when schools were closed and kids weren't getting those vital meals. So yeah, absolutely.
Dorian, we know that some of the impacts of many of the impacts actually of the pandemic have not been economic or financial, and in particular, I'm thinking of instances of domestic violence. Can you share a little bit about what we know about those, and in particular, what we can do around the Violence Against Women Act, which I know President Biden has said was one of his kind of signature accomplishments when he was in the Senate, but has lapsed in the last few years. So where are we around that?
Thanks, Barb, and thanks everyone for being here today. When the pandemic hit, I think JWI, along with lots of organizations in the field, was very concerned, right, about COVID's impact on our country, on our world. But we were thinking at JWI really about the home. It's a place that I think most of us consider as a place of refuge, a safe place, a place that, like, you know, you can leave everything else, you can leave work, you can leave whatever, and come home. And that's like a secure place. And we were very concerned that for millions of women, home is not a safe place, actually, right? And the rest of the world, their employment, their school, that is the safe place. And so when that's taken away, what happens when you're confined with somebody that's violent or abusive, particularly with the economic impacts that we've heard so much about today, raising the levels of frustration, of anxiety, of what's happening in our world with this disease, right? There are lots of compounding factors that increased the violence in our homes. And we've seen an increase of 8% across the board of domestic violence incidents, some of which are not being reported because at the very beginning, when you're quarantined with your abuser, how do you call? How do you seek help? Where do you go, right? And so really big concerns. And JWI was really thinking about this in the Jewish community. And we did a needs assessment of all Jewish domestic violence providers to try to understand, like, as Darcy was kind of talking about earlier, like, what are the programs? Like, what's happening with them? What are the needs? What are the gaps? And then we also looked at what was different for survivors. What were the impacts of COVID on them? And what we really saw in some way mirrors the rest of society. The gaps that we saw in service provision were around legal assistance, particularly long-term legal assistance, so like custody issues, things like that. We also saw the need for housing. So housing insecurity, what do you do both in the short term, as you're seeking shelter to get, out of a really dangerous situation, but then what do you do after that? What do you do the next, the first 2 to 5 years after you've left a partner? And economic security, of course, which we've talked about. But in the Jewish community, we found gaps with the clergy, as well as with our institutions, with our JCCs. And our, these kind of big organizations that are supposed to be the pillars in our society, really not centering survivors or knowing what to do. And so we are tomorrow, little plug, having a rollout, having a discussion on that report. I'll put that in the chat. But to get back to Barb's question on the Violence Against Women Act, which is one of Biden's biggest priorities, I assume he'll be talking about it on Wednesday when he gives his address to Congress. So it has been unauthorized for like a few years now, for quite some time. Money is going where it needs to go, so that's not the issue. The issue really is every few years we try to improve it. We try to make it better. We try to help more programs, more survivors, fill the gaps that we've seen from the field, from survivors and from the programs. And we've been trying to advocate for the changes that we so desperately need for the last, I don't know, Jody, how long? 3 to 5 years now, trying to convince folks in Congress and get them to really understand the needs of survivors and of programs, and address those and enhance the bill. So where does it stand right now? It passed the House just a few weeks ago. It's a really strong bill. It provides more money for culturally specific programs that serve communities of color who are disproportionately impacted and don't seek services in the same way, don't participate in the criminal justice system the same way as kind of mainstream programs. And we have money for tribal governments to be able to prosecute, and the ability for tribal programs to be able to prosecute perpetrators of sexual assault and child abuse, which they're unable to do right now, which is a huge gap and causes an immense amount of violence, terrible violence in Indian country. It provides more money for prevention education, which I think we all know is critically important if we're going to ever end this cycle of violence and abuse. And it's to one of JWI's main priorities, and I think I'll be talking about a little bit later, closes the boyfriend loophole, which allows which right now allows convicted dating violence abusers to still own and possess firearms, which is crazy. So we're trying to work in the Senate with Republicans and Democrats to create a compromise that has hopefully all, if not most, of those priorities, and really gather support for this version of the Violence Against Women Act to pass the Senate. That's where we are.
I definitely want to talk more about the gun violence prevention side of things, especially because this morning the Supreme Court's taking the biggest Second Amendment case since 2010. But before we get to that, you mentioned some of the, VOW has been around for a while. We know a lot of the impacts it had and continues to have. I think one of the important areas that doesn't get talked about a ton is training for judges in particular, so they understand how to kind of navigate this space when cases come before them. And Jody, I know how much work NCJW does around judicial nominations. Can you talk a little bit about how some of these issues play out in the courts and why particularly, use NCJW, we at the RAC, I know some other groups that are listening in have weighed in on nominations and why that's so important?
Sure, thanks for the question. I think no matter what issue you care about, you have to care about the federal courts. Every issue works its way through the federal courts, and more often than not, it's in the lower federal courts, so the district, the circuit courts. It is very few cases, less than 100, let's put it that way, that make their way up to the Supreme Court. So the vast majority of cases are being heard every single day in our lower federal courts, and the judges who sit on those courts sit on those courts for a lifetime. The last 4 years, the Republicans made it a priority under President Trump and with the leadership of then Senate Majority Leader McConnell to prioritize the court. So you may recall not hearing very much about legislation that passed through the Senate, but certainly an awful lot about judges. Primarily, the judges that were confirmed over the last 4 years were young, white, very, very far to the right, and really, with that, I would say antithetical to NCJW's mission. And so as we've been talking about these issues, whether it is nutrition assistance, food security, firearms, domestic violence, social services, social supports, all these issues eventually make their way through the courts. So as it so happens, on the day of the president's first joint address to Congress Wednesday, it's also the first hearing in the Senate Judiciary Committee on President Biden's first slate of nominees. So he has more than 100 vacancies at this moment, and the Senate Judiciary Committee will be holding a hearing on some circuit court nominees and some district court nominees, and President Biden has made it a priority to diversify the court. So after the last 4 years, again, as I mentioned, where 30% of our federal courts, the judges on our federal courts have been appointed by President Trump. President Biden came into office saying that he really wanted the courts to look like America. And in his first slate of 11 nominees, he did just that, nominating many women of color, the first potential Muslim nominee to sit on a federal court, and so on. So we're excited about what is to come in the judicial nomination space, and really hope that folks will join in and get engaged in the courts and nominees to sit on those courts before they end up on the Supreme Court.
Thanks, Jody. Mia, can you share a little bit about the particular impact of COVID and hunger relief programs on Indigenous communities and really communities of color more broadly? And before you jump in, for anyone who hasn't seen it, there's a particularly good blog Mia wrote, I think, was it like last October on Indigenous Peoples Day on the MAZON website, which is just really kind of lays this out all beautifully, but would love to hear anything, kind of updates on that and just generally how this has been playing out.
Yeah, thank you. MAZON has been deeply concerned about how COVID is impacting populations whose food insecurity has been ignored or overlooked, and that includes Indigenous communities. The issues of food scarcity and food availability and affordability were everyday concerns for Indian country long before COVID, and the food insecurity there means that Native communities are, experiencing much higher rates of diabetes, obesity, other nutrition-related conditions, which have left them more vulnerable to. And we saw those impacts in those early months. But I would say, despite pandemic severity, Indian country has really risen to the challenge. It's been very, inspiring, frankly, to see how tribes have really stepped up to protect and provide for their citizens. Everything from setting up COVID testing sites, expanding safety net programs, and of course, rolling out all of the vaccine, sites, and in many instances doing in some states. So I think what's really clear is that tribes and Native communities have their own solutions and have the capacity to put them into action, and that includes on food security issues. And so to me, it really underscores the importance of bypassing federal bureaucracies, state bureaucracies, and putting resources, money in the hands of tribes, which is why MAZON has been very actively advocating for tribes to be able to directly administer federal food programs like SNAP and child nutrition programs. And, we've been very proud to work with part of the Native Final Coalition and to advocate for tribal food sovereignty and the ability for tribes to be able to have the resources to ensure the health and safety and well-being of their people.
Open this up to everyone. Is there a particular aspect of the work that you're focusing on that has impacted communities of color and women of color in unique ways? And again, how, we know 10 to 20% of the Jewish community is made up of Jews of color as well. So this is very much an issue within our community. How have your organizations been addressing those unique needs? Start off, maybe Dorian, do you want to jump in?
The mute button. Thanks. Yeah, I mean, I think since last summer and with the murder of George Floyd, it really prompted JWI and I think the whole Jewish community, our society in general, to really think more strategically about the intersection of race in all of the work that we do, in the programming, in the policy advocacy, in the organizational policy creation, in the everything, right? And so for the work that JWI does, which is mostly in coalition partnership, I mean, it is always just trying to center the voices of the marginalized and those that are least represented. And so in VAWA, you can see that one of the biggest priorities, actually a change from last Congress to this Congress, was providing more money, more support to culturally specific communities, to communities of color, because it really, over the last year, it has changed the calculus. Even in this kind of very progressive, really like thinking kind of group of DV service providers and sexual assault people as well, to really realize that the privilege of mainstream groups that are the ones that have gotten the money historically, like we need to leave that a little and give that to these groups that are underrepresented and are more needy and you know, deserve the right to exist in financial health, in physical health, in, you know, in safety. And so I think that stream has been pretty consistent over the last year, as we're really kind of, as we were made to be face to face with the injustice that exists in our country and in our world, I think.
Thanks, Dorian. I don't want to, anyone else want to jump in on this?
I'd love to jump in. You know, I appreciate everything you said, Dorian, and then adding to it, I think from NCGW's perspective, you know, what we have seen and what I mentioned earlier is, you know, COVID has exacerbated what we've already known, and that COVID really hits squarely at the crossroad where people are most vulnerable. And in particular, it is women of color who have really borne the brunt of this. So as we've been working with Congress and thinking about, you know, how do we address, like there are so many needs and there are so many things that need to happen, and there's only so much money and there are only so many relief bills. So, you know, for us, it's thinking about a frame that acknowledges this, you know, this fact that women of color are sort of, you know, at the center of it all, and that we need a large and an urgent and a structural response that responds to this emergency, but also responds to the decades of structural inequities that have existed in our society. Without childcare, women and women of color in particular can't get back to work. Without higher wages, without training, without workplace protections, women of color in particular can't go back to work. Without a national paid sick and family leave program, as I mentioned, women of color in particular can't get back to work. An increase in the minimum wage, the tip minimum wage. The tip minimum wage has been stagnant for 30 years and the minimum wage for 12 years. So working with the administration, certainly working with Congress once the American Jobs Plan and the American Families Plan are, the American Families Plan, that is, once that one is announced, and making sure that we've got permanent paid leave, increased minimum wage and tip minimum wage, that the child tax credit is made permanent, that there are reforms to the unemployment insurance, to that program, expanded access to childcare, and on and on. But the pieces that really impact most acutely women of color.
Can I also add? You know, I think it is, you know, it's clear that structural racism is a major feature of our food system and of our food programs. And, you know, I think for many years, the anti-hunger community has operated largely from a place of kind of a colorblind approach. And, you know, but I think if you look at why government food programs are difficult to access, many of the policies are rooted in, frankly, some pretty racist notions about the people who use these programs. So whether it's work requirements or drug testing or so many different kinds of policies that are written into kind of our means tested programs. And the implication is that the people who use these programs need to be coerced to work or tend to do drugs or whatever the kind of rationale is behind these rules. And it leads to the stigmatization of poor people of color and of all people who are struggling with poverty and hunger. And so it's just one of the ways I think that racial bias is a part of the programs that we work on. And so MAZON is committed to not only reforming those policies so that people have the ability to access these programs and that there's expanded access, but I think to also start to really change the narrative about poverty toward an issue of rights and dignity, and so that no one's treated as the other. That no one falls outside of the kind of circle of concern, and that we don't create these categories of deserving and undeserving, folks who are deserving and undeserving of assistance. And frankly, I think as a society, we just need to end the stigmatization for folks who are experiencing hunger and poverty. The shame should not be borne by those folks. It really should be on us who allow, poverty to continue on in a country where we have more than enough resources to address these issues.
Thanks, man.
Yeah, I also want to just kind of piggyback on everybody else. I mean, absolutely, the murder of George Floyd was a tipping point and led our agencies to begin to examine our work through an equity lens and really prioritize centering the voices of affected communities. I mean, certainly the services that we provide have been open to all, regardless of background, faith, ethnicity, et cetera, but that's been ancillary. And we've really refocused ourselves to intentionally work to center those voices, to prioritize policies that will combat systemic racism and the inequities that have historically existed in our country. And as we look past COVID relief, we've all been in an emergency phase over the last year, and as we look towards recovery, it's really highlighting those policies that are going to build to a long-term sustainability and lifting up the voices of those communities and sustainability as well.
Thanks, Darcy. I actually wanted to ask you another question. I know we've talked in the past about the child tax credit and the earned income tax credit and their pivotal role in particularly helping women through this moment. Can you share a little bit about the role those two programs play and what their kind of status is right now?
Sure, and that's a great segue, and that actually has led, this equity lens has really sparked JF&A and JHSA's prioritization of working on these two tax credit programs. And I know everybody loves talking about taxes; it's like the most interesting topic. But really, I mean, these programs have been the leading poverty fighting tools since they were established in the 1970s, and they're bipartisan. So what's better than a bipartisan poverty fighting tool? So the Earned Income Tax Credit is a program really to incentivize work. It's targeted at low-income workers, and it increases as your wages increase until a certain point. So for example, if you're a family of four and you're making $55,000 a year, you're eligible for a tax credit of up to $7,000. And that's real money. And for many families, that's the largest check they may see all year. So that money goes to paying outstanding medical bills, utility bills, buying the kids new clothes. I mean, really, I've spoken to families, I've heard from folks that this is the check that they wait for all year round. But this program is very limited. You're only eligible if you're 25 years old. If you hit 64, you're no longer eligible. And low-income workers without children are not eligible for a large refund. It's really only up to about $500. So the American Rescue Plan included significant expansions in this program to include younger workers, older workers, and it significantly increased the check for low-income workers without children living in their home. Similarly, the child tax credit is a credit that families with children are eligible for that has not been refundable. And the American Rescue Plan has increased the funds significantly and also made it refundable. So even if you cover your tax liability, if there's money left over, you're going to get that check in the mail. And another major deal in the recovery plan, or the rescue plan, is that that money will be paid in installments throughout the year. So families don't have to wait for that check to come at the end of the year. They'll get it periodically. And so these two programs are estimated to cut child poverty in half, which is pretty incredible.
That is indeed incredible. And I would just want to add, Darcy, to you and to everyone at JFNA who played the leading role kind of in the thick of as we all dealt with the unprecedented challenges that COVID threw at us. JFNA just did an incredible job providing information and being a great resource for the Jewish community at large. So thank you and all of your JFNA team. Dorian, I want to go back for a second to the issue we kind of teased a few minutes ago. So this morning, the Supreme Court said they're going to take up this big gun violence prevention, or not even gun violence prevention, gun violence case. Maybe share a little bit what that's about, the gun violence prevention work you and JWI do generally, and of course, how does this intersect with issues around gender?
Sure. Just a few questions. So really quickly, the Supreme Court is starting to announce the things that they're going to be hearing in their upcoming session. And so it seems like they're going to be hearing one of the first gun violence cases, gun cases in, I don't know, close to a decade, maybe, in a while. And it's really looking at the ability of local governments, of big cities, really, to put limitations on who's able to carry a concealed firearm that's loaded, just like around. And these large cities have created kind of barriers to doing so. You have to say that there's a reason or need to do that, and people have sued, and so the Supreme Court will decide. And this is going to be a huge. It's going to be a really big deal to the kind of authority of governments, of local governments, to regulate guns in their boundaries. And on the other side, right, the kind of just more guns, more ammo is better and safer. So the Supreme Court, as Jody had mentioned, and it's really the whole judiciary, President Trump did a number on it, and so we'll see where we end in the Supreme Court case. But it's a huge deal and something to definitely keep your eye on. I think gun violence is always one of those things that feels like, how do you even talk about it? And over the course of the last few weeks, the mass shootings have started to increase, and we're starting to see those happen again. Right? When in the first year, basically, of COVID, people didn't congregate. So there weren't mass shootings, right? Which of course doesn't mean that there wasn't gun violence. Of course there was. It actually increased in many cities. And we're approaching summer and it will increase yet again. But we're starting to see the gun violence again. So it's really it's reigniting the need for gun violence prevention policies, and that this is still an existing problem. We just kind of had a year off from seeing it on the news. We were terrified by other things. And so I think it's always really good to just get a bearing of where are we, right? So we're at the end of April, I think, because time is weird. And so far this year, 13,616 people have died by gun violence. Almost 6,000 of those people were killed by homicide or unintentional shootings, and 7,656 were suicide. Right, so this is something that's not talked a lot about. It's about 2/3 of all gun violence is suicide, of gun death is suicide. And I think for what I just said, mass shootings feel like the thing that really causes violence and death in our society by guns, but that's not true, right? Gun violence exists in lots of different spaces. It's domestic violence, which is how JWI enters the gun violence space. It's suicide. It's urban gun violence. It is unintentional shootings when a child finds an unlocked firearm. It is a whole range of issues and circumstances that kind of all come together to create what is a uniquely American problem, our gun violence epidemic, right? Barb, you had mentioned earlier, like the family leave, right? Like it's a uniquely American issue that we don't have supportive policies to help women stay at home and keep their jobs and be able to return to the workplace. And gun violence is one of those other really unique issues that happens in our country that has devastating consequences in a different way than paid family leave does. And so how it impacts women, I mean, of course, women are in all of these communities. Women are everywhere. Every issue is going to impact women. Oh, one thing I forgot, gun violence is also police violence. As I'm talking about women, I'm thinking of Breonna Taylor. And so, you know, it impacts women, it impacts men, it impacts children, it impacts communities. It impacts these communities that are so that even if you weren't personally impacted by gun violence, even if you weren't shot or shot at, there's trauma that exists in the school shootings, in these communities, in these urban communities where gun violence happens often. And it really is a huge problem. And so one of the questions, right, is, so what can we do about it? After March for Our Lives, I think a lot of us thought things would change. After Sandy Hook, I think a lot of us thought things would change. After Columbine, we thought things would change. After a lot of horrible, after the shooting in Atlanta, we thought things would change. And yet we're still here, right? So, I mean, there's lots of legislation. Later in the chat, you'll get an action alert. 2 pieces of gun violence prevention legislation passed the House earlier this year in the first 100 days of Congress. They will languish in the Senate, maybe come up for a vote. You know, we're talking about background checks that, you know, just say that everybody should get a background check before purchasing a gun. Like, it's not crazy. We call it these common sense gun reforms. You know, closing the Charleston loophole that allows people to buy a firearm even if they haven't passed a background check because the background check hasn't come back yet, right? That after 3 days they're able to get it no matter what, even if it comes back that they're prohibited from having a firearm. The boyfriend loophole that I mentioned earlier, assault weapons ban. I mean, when you're looking at mass shootings, what do they all have in common? Relatively the kind of firearm and magazine that they're using. You know, hate crimes, people that have been convicted of hate crimes probably shouldn't be able to have a firearm. Like these are kind of things that you would think like make a lot of sense, but in Congress, in the Senate, it is hard. It is hard to get 60 votes. And so then what do you do, right? Like, so we can support these policies all day long, tell people that it makes a lot of sense. But I think at the local level, there's a lot that can be done. I think it's really important at both kind of the city level and the state level, like really easier to make an impact, right? People represent less folks. And the 2 more things. One is research. So for a long time, no federal money went to research gun violence. But last year that changed. And so it's really important that we keep that money going to the CDC and NIH, and also kind of think about gun violence as a public health crisis, which it is, and money for violence intervention programs. It has become a huge priority for both the gun violence prevention movement and the racial justice movement, a lot of folks, and the Biden administration. And so it is getting money out on the ground to people that work in these communities, in these urban communities, to try to reduce the violence. You know, and this exists because of a confluence of systemic racism, right? It's because of the educational system and the housing system and the financial economic system and how these folks have been underprivileged for generations, really.
Yep. So I want to make sure we have time because we have a couple of questions in the chat. So for anyone who wants to jump in on this one, how is the cost of Jewish life factored into your work? So we all know there are not insignificant costs to day school, for camps, kosher food were some of the examples in the question. So so I will open it up to anyone who wants to jump in on that one. And while you are thinking about the answer, our colleague Stephanie Hausner is putting in the chat box some of the actions that we can all take on a lot of the issues that have been raised here this afternoon. And if you go onto the websites of any of our panelists, you can see lots more opportunities for action as well. But does anyone want to jump in on that first question? Darcy, go ahead.
I can, always happy to jump in on Jewish life. So two things. One was the Paycheck Protection Loan Program that JFNA, among other leading nonprofits, advocated for last spring to ensure that it was as expansive as possible and also included nonprofits that accepted Medicaid, which was an issue at the beginning. And we've also advocated for increased funding for that program to help support nonprofits in general. But we really led the charge as far as making sure that Jewish institutions were aware of and able to understand this program. And I know that I think thousands of Jewish organizations were able to secure significant funds to allow them to sustain their operations. So it doesn't necessarily go to the cost of affordability of day school, summer camps, et cetera, but we work to support those institutions so that they could continue to operate. Specifically about kosher food, many of our member food pantries are not necessarily kosher, but have kosher food sections. There are a couple exclusively kosher programs, but one of the emergency programs that came out of the CARES Act was the Farmers to Families Food Box Program, which essentially designated billions of dollars to purchase food from farmers, put it in boxes, and send it off to food banks and then to food pantries. And the program over the summer was incredible. It was produce only. Certainly it had some issues, but it also succeeded in bringing tons and tons of produce to needy families. And that program switched, the regulations switched in the fall to require the boxes to hold meat and dairy and produce all together with a rule that you couldn't open the box. The food pantry could not open the box. It had to be distributed in full, which led to a variety of issues. First of all, that kosher and halal food pantries were not able to participate because they couldn't accept or distribute a mixed box like that. But it also was significantly problematic for food pantries that didn't have the storage space, the refrigerated storage space for those boxes, which, by the way, weighed 40 pounds. So we were working with kosher and halal advocacy organizations to work with USDA to make the program better. And it looks like they've actually discontinued the program and will be doing a produce only program moving forward with the remaining funding that was designated. But certainly it's something on our mind to make sure that dietary restrictions like this are taken into consideration with all these emergency food programs.
If I could also, I think that question is really interesting because in JWI's needs assessment of Jewish domestic violence survivors, one of the limitations, particularly in housing, was the location. And sometimes there is like an emergency shelter that's within the community, but oftentimes when a survivor is seeking kind of longer term housing, they have to go outside the Jewish community because there's just nothing available. Like the way that our systems of government work and that don't allow or make it more difficult for people to accept things like Section 8 and other kinds of housing vouchers. More regulations with the federal government, so people just don't want to do it. And so it's actually one of the recommendations we have is to bring people together landlords, other members of the Jewish community, to try to think through, like, how can the Jewish community center survivors and be a better steward in terms of Jewish day school, housing in the community, synagogues and temples. Like, what can we do, right, to allow these women and children and families to stay in the community, a community that they often want to stay in and feel like is their home. So I get it. The cost of Jewish community is higher than lots of other surrounding communities, and having people be able to maintain the Jewish life that they want is challenging.
We have 5 minutes left on our clock, and I want to do a quick lightning and give each of our speakers just a chance to spotlight one thing people can do. Maybe it's what we shared in the chat, or maybe something else. Mia, we'll start with you.
Hey, well, I'm gonna maybe squeeze two. I didn't really have a chance in the American Rescue Plan. The program had 15 boost extended, and that's only going to last until September. You know, that's there's nothing magic about September. We're looking to make sure that that boost stays in place until the economy recovers. There's an action alert for that to urge Congress to do that, and that Congress is making some noise about renewing the child nutrition this year, and before, you know, my is really interested in the impact in Indian country that these kinds of programs have. So we think there's an encourage the ability for tribes to directly administer school programs, and that's another place where we'd love to get some support and an action alert on that as well.
Thank you. Jody, 60 seconds on the clock. Over to you.
All right, cut me off if I go too long. In addition to what Mia said, it's things like nutrition assistance, buttressing the SNAP program, robust supports for workers and families in the plans that Congress is going to craft. So I mentioned the American Jobs Plan. We're going to hear more about the American Families Plan on Wednesday. It's on Congress to draft the legislation. These plans should be talked about together. They should be talked about as helping America, not just women, and they should be passed. Investing in caregiving and related infrastructure is really critical at this moment so that we provide the scaffolding that we need for an inclusive and a resilient economy. It'll create jobs and it'll help our families. It is not partisan, but it is American.
Okay, Dorian. 1 minute, hit it.
Yeah. Yes, to my other panelists, support their priorities, because they're all of our priorities. And I'm just going to go with VAWA again, because I've spent the last 4 years of my life really hoping that it gets across the finish line. And this is their best chance to do it. And so anything that you can do to ask your senators to support the House passed bill and come to the table or come to the table to create a compromise that, violence against women is not partisan. It historically has not been a partisan bill, and we need people to come to the table.
Thank you. And Darcy, over to you. Last word.
Thanks, Barb. I'm going to talk about taxes again. Let's make the earned income tax credit and the child tax credit expansions permanent. We're going to be working to urge that any recovery package to include permanence for those programs. And quick plug, JFNA is holding a webinar on Wednesday at 2 p.m. Eastern with the IRS about how folks can apply for these credits. So you have any clients, if you know anybody who might be eligible, check it out. I'll put the link in the chat. But we want to make these important programs permanent so that everybody can take advantage of them.
Thank you, Darcy. Thank you, Dorian. And thank you, Mia. Thank you, Jody. Thank you to everyone who participated. And you saw in the chat, there's lots of ways to take action on each of these items. You can do it through through MAZON and through JFNA and through JWI and NCJW and the Religious Action Center, and of course JCPA, who hosted this fantastic session and the conference. We'll see you all at the next program, and enjoy the rest of the day. Thanks, everybody.